Okay, it's 8 o'clock and welcome to today's episode of Marvelous Medicine, which is about feedback as a learning conversation. Our speaker is Dr. Subha Ramani. She's an associate physician in general internal medicine and primary care, affiliated faculty in medical communications at Brigham and Women's Hospital, and faculty in medical education at the Brigham Education Institute at Boston. Dr. Shubha did her MBBS from Stanley Medical College and MD Internal Medicine from PGI Chandigarh. She went on to do her Masters in Public Health from Boston University, Masters in Medical Education from University of Dundee in Scotland, and her PhD in Health Professionals Education from the Maastricht University at Netherlands. Dr. Shubha focuses on educational pedagogy and rigorous scholarship at Brigham and Women's Hospital, Harvard Medical School, MGH Institute of Health Professions, and other national and international venues. She's passionate about enhancing teaching and educational scholarship among residents and faculty, and is keen to establishing a leading community of educators. Thank you, Dr. Shubha, for immediately agreeing to do this talk. Actually, we met in the hospital where she had come to see her mother who was hospitalized, but I have Marvelous Medicine ka bhoot sawar hai, so I don't lose any opportunity to corner people into coming and giving talks, and she was gracious enough to immediately accept. Thank you, Shubha. And just for the record, Shubha was a contributor for Marvelous Medicine right from the first episode. And the first talk was done by Amit Ghosh on pedagogy and medicine, and he specifically said that he took inputs from Shubha. So nice to have you actually here on Marvelous Medicine finally, Shubha.
Thank you very much for inviting me. And it's nice to actually come back and contribute to medical education in India, because I left a long time ago. But I have a lot of friends in the country, in the area. And in fact, Ram Subramaniam sent me a WhatsApp message after seeing the poster for today's session and say, wow.
But let's hope he logs in.
Yes. And he was my junior at PGI. He was actually my husband's junior in MMC and our junior in PGI. And we've been friends since then. So in any case, one of the things, why I like education is for those of us, we are doing teaching all the time, even if we are not professors at an academic institution, because you have trainees with you all the time, and you have nurses, you have so many healthcare professionals, and every day, whatever you do, you're teaching. It may not be a lecture, but that's not the best form of teaching necessarily. But today we focused, and I offered Vidya a couple of topics, and she chose feedback, which is, believe it or not, one of the most difficult and challenging topics in the West or the East, because there are challenges in the East, there are challenges in the West, different challenges, but it's difficult all the same. And this was my PhD dissertation. And basically what I studied was not that feedback is how to give feedback. There's about 100 models to give feedback, and none of them are successful. Sorry about that. Okay, something. And it's not about how to give feedback, but it's a conversation. It's actually a social event. Just as we don't talk to different people the same way, it's the same thing about feedback as well. It is a social, and for those of you interested in psychological theories, it's a socio-cultural interaction, which means it's social, yeah, cultural, because it depends on cultural context. So what we do in the US or Canada or Germany or the UK is going to be different than what you do in China or Japan or Singapore or India. So it's very much adaptable to the cultural context. But this is going to be an interactive where I'm going to ask you a lot of questions. Feel free to unmute yourself and share your insights. But if you're unable to unmute yourself, and go ahead and type in the chat as well, and I'll try to follow along as much as possible. But it should be a dynamic and interactive session. So let us start. This was the topic I deliberately chose, feedback as learning conversations. And as by the time we finish, you'll understand exactly why I chose this topic. So what are our objectives today? We're going to redefine feedback from the feedback recipient's perspective. And note, I'm not saying teacher, learner, student. No, I'm actually saying recipient, which means the person who's receiving the feedback. It could be us. It could be the students. It could be the PGs. Then the next thing I want to introduce you to is this in the concept of feedback literacy. And then analyze this thing about what is a learning conversation and where does feedback fit in. And I'll show you a framework which basically can allow you to adapt certain strategies which follow coaching principles. So this is actually the 1983 when feedback was starting to get popular with clinical teachers. This was obviously Jack Endy from, he was at Boston University at that time, and he wrote a masterpiece on feedback. But this was the essence of his definition. Feedback is the practice of providing information to learners about their performance in clinical situations to guide their future performance. Classic definition. And I'm going to let you react to this definition. But the way I looked at it is, in my PhD, when I started off the review of literature, I started like this. I said, we are making a lot of assumptions in order for that definition to be true. One, teachers appraise performance. Teachers provide assessment or appraisal data. And somehow magically, that's where the magician's hat comes in, the learner improves performance. Now, what assumptions are we making? The first assumption is, I think in the surgical world and other procedural world, you observe your learners much more. In the physician world, we don't. They come and report to us, and then we assume that all the data they gathered, all the clinical reasoning they have done is true, is accurate. So direct observation, and as we get busier and busier, we observe when we have to, and then we take what our learners say. Data we give them on feedback, the learners accept, they incorporate into their performance, and then they improve. So I want all of you to sort of react to this definition and then tell me your comments or your thoughts about why is feedback needed? What is your approach to giving feedback? Let me stop so I can see everyone. And feel free to unmute, show your video.
Hi, ma'am.
Yes, go ahead.
Yeah, because we may not be very good at judging ourselves. So, like they say, we can't see our back. So, other person can tell us how, about our performance.
That is an excellent point. That is an excellent point. Any other comments? Okay, let me open the chat as well for those who are not speaking. And here we go. I adore my friends and colleagues who give me feedback to tell me about my flaws. Now, I'll tell you something you've got to tell me. It's been a long time since I've read Hindi, so you've got to tell me what it means in English. An improvement of systems and a method of encouragement. Keep the critic with you. Okay. All right. Wrong is wrong. Not comfortable with sandwich. Yeah, okay. And we'll come to the sandwich method, or I'm not even going to present the sandwich to you. How to tell somebody is wrong diplomatically. Excellent.
Yeah, ma'am, I've typed it in Hindi what Abdul Rahim Khan said almost 500 years ago.
Okay.
He actually means that keep the critic with you, or rather
Yeah.
critiquer, the one who acts like a mirror for you, mirror for me. And if somebody tells me about my flaws, I'm always grateful. That has been the way I've been brought up. So it is very useful instrument to take me through Kolb's cycle, and helps
Yes,
me to really do active, the reflection and
Mhm.
also abstract conceptualization. Once I
yes.
have really helped, once my colleagues have helped me with feedback, it actually means that keep the critic with you, even if you have to give him or her a place in the backyard of your house. And without soap and water keeps your professional conduct gentle. That's what it
Okay.
means.
Thank you. Thank you very much. And the rest of the slides will basically reflect what you just said, or everything that you said. We're going to talk about it. And feedback is a kind of constructive criticism. Okay. And we'll see if it is a criticism or just constructive. That's fine. And I agree with everybody.
Ma'am, I would like to point out, so feedback is also a type of, in fact, if I take the context of medical education, it's a type of formative assessment,
Correct.
as in one just learns. It's not just how you're teaching, but what you're
Yeah,
teaching.
yeah.
So
Okay.
Formative
that is,
assessment, yeah, cannot happen without feedback. Yes, and
Correct.
not only for the candidates but also for the program, how effective our teaching program is.
Agreed. Agreed. And agree with all the comments. But I will say one thing. I'm going to be, a scientist, an education scientist, and actually say assessment and feedback are related, but they are not the same. Because ultimately, assessment is about a judgment. Does this person have the capability to move on to the next step? And even if it's formative assessment, you have a series of formative assessments which then make up a summative assessment and say, are you ready to move on? Do you need to do some remediation? So feedback has to be a conversation, okay, between two people. And the person who is the teacher in this instance needs to be trusted by the learner in order for them to take it. And the trust allows people to talk about the flaws, accept their flaws, and then continue to improve. So I agree with everything. Assessment and feedback are very much related, but they are slightly different. And formative assessment cannot lead to summative assessment or accurate summative assessment if without feedback. So agree with all those comments. And feedback is the teacher's input to identify progress. Yeah, it's not just about how you're performing, but define progress towards a goal. And this Elango's comment, it comes back to coaching, which we're going to talk about. So I've lived in America for very long, so I will drop the doctor in front of the name and I might just use your first name, and you feel free to do the same. And I'm Shubha, I'm not Dr. Shubha, we're all colleagues. Been in America too long. All right, let's go back to the slide. Now, there are people, and these people who said it, Bingyu and Trowbridge, they're actually clinicians, clinical teachers, very close to Boston in Maine, in the state of Maine. And Bob Bingyu particularly had an MBA. Believe it or not, people with MBA know a lot more about feedback and appraisal than medical educationalists do. So this is what they said. They said educators may have been too focused on a narrow view of feedback. Approach to improving feedback should not only incorporate teacher behaviors, but also learner-based cognitive principles and a focus on the teacher-learner relationship. I'll go further and give you a very simple definition from someone in higher education in Australia who's done a lot of work on feedback, David Boud, and he basically said, feedback should be viewed from the learner perspective, or I can say the receiver's perspective or the recipient's perspective. How can feedback be effective if it is not accepted, assimilated, and leads to behavior change? So even if we have done a fabulous job, like Shivaji Ganeshan, we've given feedback, perfect dialogue and everything. But unless the learner improves, what's the point? So moving on to the newer feedback concepts, I'll talk to you first about credibility. What is feedback credible? what determines whether feedback is credible. Then I'll bring in something called feedback literacy. And then we'll actually get to the learning conversation and end up with a coaching framework. So I'm going to ask you to do this. You can either reflect, just think back for 30 seconds, the most useful feedback experience you have had. What made it useful? One thing that made it useful. Or you can also think about a feedback experience that was not at all helpful. What is the one factor that made it unhelpful? So I'll give you 30 seconds to reflect, and then you can talk or type.
So if nobody's speaking, one of the most useful feedbacks I got was from my students who joined me for, they joined me for the first time for a conference, and they told me that I spoke too fast and tried to fit the entire topic into that. It was a lower GI bleeding, which is a huge topic, and I tried to fit it into the 10 minutes. And I realized what they said was absolutely true. And because, I know it takes a lot of courage to tell a senior, I realized that they really must have meant it and felt it. And I think that's what really made it. And now I always ask myself, is the slide necessary? So I think that was very useful for me.
Thank you. And that comes from the perspective of the teachers, how useful our learner feedback is in improving our own performance as teachers.
For me, the regularity with which I met my transplant trainers, Dr. Hughes and Dr. Humar, I used to meet them once in 2 weeks to pick up what errors I've made in the previous 2 weeks during surgery, actually helped me polish off all the surgical skills during the time of training itself. That was a different experience. One of the seniors advised me to do this. It changed the way I learned surgery.
No,
Yeah.
it's a very good point. And this is what we call feedback in the moment. We try too much to have them sit at the end of a rotation and drown them with feedback. But in the moment, during surgery, someone is watching you and giving feedback and giving you an opportunity to improve. And you know right then and there, they're watching me, that therefore their feedback is credible. Okay, it's believable. And they're not criticizing me as a human being, as a person, but they're actually talking about my skills. Yeah, very, very true. And why I even asked this question, as other people are thinking, is there's a lot of research that basically shows that the teachers and learners are not on the same page about feedback. One, the teacher thinks they gave great feedback. The learner says, I didn't get any useful feedback. Two, the teacher thinks, oh, I've given feedback, and then tomorrow the learner is going to improve. But the learner hasn't even taken it inside 1 year. And this is why this whole concept of credibility came up. So if you're giving feedback and the learner is not even thinking of this as a credible data source, they're going to reject it. And that leads us into this concept of credibility. And next, the feedback literacy, which is fairly new in the research world of feedback. So we can look at what makes feedback credible from the receiver's perspective. So as far as if we are thinking learners and or teachers as well, is this based on my goals? So I want to improve my lecturing skills in a short time. I want to be able to teach meaningfully in 10 minutes. That's my learning goal. So if somebody is giving feedback on something that's totally unrelated to that learning goal for that day, then our brain just blocks it out. So is this around learning goals? Of course, we'll always add something important that we observed, and that's not part of the learning goals. That's different. The other thing, I think there was a question raised, common, how do you engage the learner during this feedback conversation? So we want the learner, most of our learners, especially postgraduates, yes, the students are younger probably and need to be coached and guided a little more, but the postgraduates are adults. They have families. They are very mature. So we need to engage them in self-assessment and self-reflection. So tell me what you did wrong today. What did you do well? So where is it you'd like to improve? And the other thing people talked about, I think people use the word gentle, diplomatic, and this is a concept of self-efficacy. We insult them, we humiliate them. I've learned by humiliation, and many of us have. I remember one professor who never heard any right answers that I gave, only heard the wrong answers. That very selective permeability of his tympanic membrane. So self-efficacy, if you're insulting me and basically telling me I'm useless, then I'll say, I'll stop listening to you because you think I'm useless anyway. So from the provider's perspective, is it based on, just as was mentioned, was it in the moment based on observation of my skills, observation of my performance, and perhaps a little understanding, was it a rough shift? Was it a challenging surgery? Was it a challenging patient? Some understanding of context. And then also are they looking at us, the teachers, as beneficent people, meaning we are very concerned about their well-being, their growth, their development, and we're not just to humiliate and insult them. Then there's this concept of relationships, the teacher-learner relationship. I'm talking about anything personal, but really a professional relationship. The longer we work with a learner, the more time we have to see them develop, and it's much more meaningful. But much of the time, we don't have an option. Like some of the students, they come for a short time. So we have to go back to the principles of let's get a goal out of them, let them self-reflect, and then let us find out one way they can improve. Another thing is whether we're scolding them on the last day of a rotation, and we haven't even given them an opportunity to improve or try out new skills. Finally, is the organization or institution. What are the expectations for feedback? Is there training around feedback? And then is the hidden curriculum, are we lecturing about professionalism and showing them unprofessional behavior ourselves? So these are all the various factors that make feedback credible or not credible. Then we have this whole area about, is the feedback accepted? So what makes feedback acceptable? And there are a lot of researchers in the education world, in fact, in higher education, in high school and college education, not even medical education. Now medical education is talking about this. They said, they defined it like this: the understanding, capacities, and disposition needed to make sense of the information and use it to enhance work or learning strategies. So there are so many things. You understand, you receive, you understand, you make sense of it, interpret it correctly, and then use it to improve. So that's feedback literacy. And this is looking at it from the learner perspective, or in our case, the teacher perspective, if the learner is giving us feedback. So 4 points about enhancing feedback literacy. Even somebody asked right at the beginning about how about teachers getting feedback. So we have to show our learners that we have feedback literacy. The fact that we appreciate feedback, their feedback, we will receive the information and make judgment, put the information together and make a judgment, manage our emotion. If we give constructive feedback, it doesn't matter how old you are, you're going to have some emotional reaction. Manage that and then take action to improve. So this is feedback literacy, very, very related to what makes feedback credible. And you need feedback literacy in order to accept constructive feedback and use it to improve. Okay, let me look at the chat and then we'll talk to. Yeah, learning environment, exactly. Then a learning environment is very, very And we are going to talk about the learners asked how they feel immediately after the event. And we're going to talk about that framework, which exactly alludes to that point. Too many suggestions, nothing actionable. Indeed, very much so. Okay, made you defensive. And this is what we talked about, in self-efficacy. We don't want to feel like fools as human beings. We are adults, we're not kids. Even those students, medical students, they are 18 years old. So they are on the cusp of adulthood. But postgraduates, teachers, us, we're adults. So let's see how it's kind of humorous in a way. There are people who started doing some studies, and they found whenever you use the word feedback, it elicits a negative reaction. It's like, oh, what did I do wrong? So, but that's not what feedback was defined as. Well, maybe in the engineering world, that's how it was defined, to find a fault and to fix it. Unfortunately, we took it from the engineering world and adapted it to the education world. It's always find a fault and fix it. And there were some scholars who said maybe we should drop that word feedback and call it a learning conversation. So as an example, one learner was asked, did you get feedback from your supervisor? No. And then they split it up and said, did the supervisor observe you doing anything during a patient interaction? Yes. Did you talk about it? How you performed? Yes. Did you get something out of it? Yes. Did you improve as a result? Yes. Did you get feedback? No. So this was a conversation that this
Hello.
did not even see as feedback. So we should start,
और
thinking.
आरे को करें.
I guess we should start thinking about feedback as a conversation, respectful conversation between two adults. So what is a learning conversation? It's an empathic, respectful, listening and advising conversation between adults, facilitated to ensure that key learning emerges from this process that informs future practice and behaviors. I'm going to show you a framework and then pause for your comments. So this article was published in Academic Medicine. And this looks like a complex framework, but it's not. I'll just explain in a second. Let's focus on the left side. And it summarizes what many of you have said already. So let the learner drive the conversation, especially when they are more senior and more mature. They may need to be guided if they are less mature. So the learner starts by participating in an experience. One of you talked about the Kolb cycle. Yeah, that is experiential learning. So an experience. When they engage in the experience, they perform. The educator observes this performance. And then this combination of performance followed by observation leads to reflection first from the learner. Same question I think many of you have asked. And then they go into a learning conversation, which is perhaps led by the learner, facilitated or guided by the educator, and learning occurs as a result. So this is the concept of a learning conversation. This is feedback, but I think it's nice to split up each of the steps and see the learner is allowed the accountability or empowered to lead. They participate in the event, they perform, the teacher observes, asks the learner to reflect, and then guides the learner in a conversation, which leads towards improvement. Well, the same things that affect credibility will affect a learning conversation. The influencing factors are learner characteristic. And we talk about things like, is the learner receptive? Do they have a mindset that is a growth mindset, which means, just as some of you said at the beginning, I want to know my flaws so that I can improve. That is exactly what is called a growth mindset. The educator characteristics, I'm here to scold you and insult you and humiliate you, not really to make you grow. The relationship between the educator and the learner. What is the professional relationship? The learning environment, as you said, what kind of environment are we conducting this professional relationship? Performance features. So maybe a surgical skill or a procedural skill is easier to take criticism on. But if you start talking about communication skills, professionalism, interprofessional behaviors, it becomes a little more personal. So we need better language to address it. We still need constructive feedback on that, but the language needs to be a bit different. Is it guided by the learning objectives? And what is the societal norms? This is the last bit, which is what works in Canada may not work in India. So we need to find a balance within our own cultural context. Because one of the studies I did with a colleague and I'm going to stop sharing so people can start interacting here, give your comments or chats. So I did a research study on feedback with a medical educator from Thailand, from Bangkok, University of Bangkok. And our findings in the US and her findings in Thailand were very different. So the learners there said, I will take any amount of criticism from my teacher if I know that there is a plan, an actionable plan at the end, and it is meant towards making me grow. Now, in North America, the students are a little more fussy. They don't like hearing criticism. So what the teachers have started doing is stop giving constructive criticism and then just give good job. And the most common constructive feedback given is read more. So they actually noted down the phrases. They said, great job, read more. And no learner is going to improve based on that. So we talked about what makes feedback credible. What is this concept of feedback literacy that is ready to receive feedback? Then we talked about how feedback is actually a learning and growing conversation. So I'm going to pause here before I go to the framework for people to comment.
I'll just take this opportunity to quickly introduce Tilaka. Dr. Tilaka Mutaya is a clinical lead, simulation, and consultant anesthesiologist at Apollo Simulation Center and Apollo Specialty Hospitals, Vanagaram. Tilaka did her MBBS from Madras Medical College and MD Anesthesiology from All India Institute of Medical Sciences, Delhi. She is also a diplomate of the European Society of Anesthesia and Intensive Care. She has over 20 publications to her credit and has been invited faculty at several CME programs and conferences. Tilaka is also the founding member of the Neonatal Anesthesia Society of India, and her special interests are simulation-based training and quality improvement. So my first baby steps towards giving and receiving feedback is thanks to Tilaka, because she conducts these programs over weekends, which even working people can attend. So I attended one of the faculty development programs, and the reason I was telling that this training actually changes you in a very fundamental ways, because now Tilaka doesn't use the word minus at all. If you tell her we do something and you say what are the plus and minus, she'll say plus and delta. So that's Tilaka for you. Yeah. So Shubha has requested that you start typing your thoughts on chat, and also feel free to unmute and speak. So Tilaka, till somebody else gets ready, maybe you want to say something?
Yes, thank you so much, ma'am. Thank you so much. Dr. Subha, I love the concept of feedback literacy, because that just brings out something that I have at least never thought about. Should we really educate learners on how to receive a feedback, because we never ever tell them. We just presume everything and we give them feedback, and we presume that probably if we learn the right way to give feedback, they will receive it. But we have never taught them how to take a feedback. I do not even know if that is existent, if somebody practices it, or even how to do it. Like, how do I tell my learners how to receive a feedback? So that's completely opened up a new thing for me. I've like written down, put so many important marks there. So if you could just share your thoughts a little bit more on that before somebody else could ask for something.
Sure. And Tilaka, very nice to meet you. And congratulations on everything you're doing so far to improve medical education and particularly faculty development and teaching skills. So you are right on target there, because there are universities, there are medical schools who are actually doing feedback training, feedback receiving training for students. And in fact, in Australia, I will say that is where a lot of work is happening on training students on this concept of feedback literacy. And I think one of the first places was in the emergency department training in rotation in Sydney, I believe. Yeah. And that's where feedback literacy training is happening, where it's not the faculty who are taught how to give feedback, but it's the learners who are taught how do you seek feedback, how do you receive feedback, how do you accept feedback, and feedback literacy, appreciation of feedback. Yes, it is happening, not nearly enough, but yes, other people like yourself have thought about this.
That's really encouraging, madam. I think, at least for me, I will immediately take this and start working on this.
Looks like people will be needing some prodding. So, Shubha, maybe you could just ask some questions which people could respond to.
Okay, so
Suma, just a minute. Suma, would you like to unmute and speak so that everyone can hear what you're saying?
Yeah, I mean, that's a very nice talk. And I completely agree with the professionalism and everything required in both in training and in acquiring feedback and the importance of it. But the point is also that, see, if a resident really isn't making the grade for a number of reasons, okay, in the Indian system, both, I would say, both in the government as well as in the private learning centers, we don't actually have a provision for a resident to leave the course. We don't have it. I mean, in a private system, it simply doesn't exist because they paid the fees.
yeah,
It's almost like a guarantee that they have to emerge from it.
Think we lost Suma.
And I've seen where in my time in the UK, I've seen how these situations are managed. They are advised to take up different professions. They are advised to change certain lines within the same speciality. There are a lot of constructive ways in which this is done, and there is this. There is the thing that at the same time firmly they are told that they are not going to progress. Okay, the thing we don't have that here. We really don't.
Yeah. And I will tell you, Suma, it's a major issue that you're raising. It's a big challenge. And believe me, I don't have an answer for that. Like, what can we do? I think it's leaders like yourself, like this group, that probably need to change the system from within. However, what I will say, in the US, it is just as hard to have residents leave the program, because there's a very kind sort of system towards young trainees. I lead the clinical competency committee for my internal medicine residency program, and the number of excuses we make, we have this, we discuss the residents every 6 months. We have to benchmark against the milestones established by the accreditation bodies. And we'll see all these narratives from the evaluations that say they're not making the cut. But then we say, oh, maybe this is the first time. It may have had a bad day. And we make excuses for them. It's not that easy. And in the US, actually, you have to, and unless you document every step of the way, the residents can come back and institute legal proceedings. Like, okay, where's the documentation that I'm incapable or I've lacked competency? So it is a big challenge. The only thing we can do, one, I mean, I don't have the solution to changing the system. However, one of the things that I think as you have experience in the UK, in the US that's happening is more regular clinical competency meetings. So we discuss all the residents in the program, and each one of them is, they have each, educational leader is assigned a group of advisees, and they are asked to meet with them and have this personal improvement plan. So frequent opportunities for performance improvement. So, and remediation, that's the other thing. And then, when we talk about the residents who are particularly challenging, and we sit and talk about every step, a few steps that we can do for remediation. If this is knowledge, here are some approaches for remediation and who will do the remediation. If this is professionalism, here is what the steps are and who will work on this. Like we have more than one person, like they may be, a registrar, like who is a much more of a peer as an example and much less threatening to work before a consultant level person talks to this resident.
Yeah.
So there are mechanisms, but I will acknowledge what you said. This is a big challenge. And in your situation, if there is no provision to make a resident leave a training program, it is a big challenge. But we have a provision, but theoretically, practically, it rarely happens. So
the thing is, yeah. Please continue.
Yeah, so the only thing to do, I will say, start from the beginning. I think it's the feedback literacy concept, which, Tilaka talked about. How can we train our learners? So starting from the beginning, and then how do we train our faculty? Again, and as it was said before, during surgery, every step of the way, I was given feedback and the flaws were pointed out. And then if that kind of a professional relationship exists and there's documentation around the narrative, and then we can say, all right, we really need to take it higher up. So it is difficult. I don't disagree with you.
See that, what happens effectively here is what I have seen is that the resident whom people think really has no hope of improving, you often find that in the final exam, they just tell the external that, look, there's absolutely no point in detaining this candidate for another 6 months. They're not going to improve. We might as well just pass them now. And so actually a candidate who's failed will technically be someone who has the potential to improve.
Sure.
And a candidate who has no potential to improve is more likely to pass the first time round because people just don't want to think of examining that candidate once more. That is the reality that happens.
Sure. And that's going to happen all around the world. There's going to be sticky situations, system-based situations. But what I will say is for most of our learners, for most of our trainees, they come in good faith. They come with the intent to improve. And, for those in that situation, we as faculty, we as supervisors can do a good job giving them feedback and helping them grow. So there's always going to be negative situations. One other thing, one word that, while I'm waiting, please do type in any comments. One word that was used earlier and which I want to react to is mirror. So I will say anyone who has done any executive leadership programs or any kind of business administration programs, much of the work on feedback comes from that world, not from education world. And the plus delta we talked about comes from the management world. So it is plus, what did you do well? Continue to do it. Delta, what do you need to change? So the language is going away from you did right and wrong, you did good and bad. This is positive and negative feedback. Rarely, if ever, we use the term negative feedback these days. Constructive, yes. And we don't even use the word corrective, constructive. The other thing around clinical medicine is it's not a solo sport, and we're all acknowledging it's a team sport these days, right?
Yeah.
We have multiple professionals coming together and working. It's a team sport, and there is this gradual understanding that each member of the team will contribute, will have a high level of skill, and they will be mediocre in something else. But the next person on the team will have a different strengths, and together we can contribute extremely high quality of care. So that is another concept in clinical care that's changing. From the time when I was a student, you go home, hide your books, and study for your exam. Don't share anything because you're competing against your fellow students. And so it's the world is changing everywhere, but challenges will remain. So in terms of the second thing I learned from the business world is it's called gazing through a window and looking into a mirror. So two forms of feedback conversations. Gazing through a window, you can't see the world, right? You see one segment of their performance, which means multiple supervisors, multiple teachers need to see multiple types of performance. Everybody brings together all these pieces and constructs a whole. So gazing through a window, you only see one snapshot. So that is not the most effective way to have a sort of a summative feedback. Looking into the mirror is, just as people said, sometimes we might be repeating like parrots. So you say, so what do you think was going on? They'll say something, you repeat back to them, and then say, I don't think I'd communicated well. You repeat back to them. So you're basically being a mirror. And sometimes I've noticed in the right setting, and with most of our residents, if you're being a mirror, they in fact pull out all the negative points before you do, because they're criticizing themselves, and then you're left in the good position of saying, no, actually, I noticed some positive points here. Let's do the plus. So we have a lot of learners like that as well. So being a mirror. All right, let's see what's in the chat. Yeah, I like the comment. Do we have any evidence anywhere that failing someone has improved anyone? If yes, shouldn't everyone be failed? Fair point. That's why I talked about, this being a team sport. And yes, Ravi Shankar. Go ahead.
So you're muted, Ravi. Sir,
Yeah. I'm trying to unmute myself. Sorry. So I was going to flip it around, and I come from the business end of things right now, so I'm not talking about trainees. But the one thing but I think this is relevant to the academic setting as well. I find that people, in an effort to be kind and not very nasty, do not give proper feedback.
Sure.
And it comes back to bite everybody at the end, because people are considered to be competent or good, and they keep getting promoted, especially from the lower rungs. And then they come to a certain level where they need to have a certain amount of competency, a certain amount of leadership skills, and they don't have it.
I agree.
And that's so how do we sort of get beyond that, and how do we get people to give honest feedback, and how do we get people to understand that honest feedback is not being unkind, is not being inappropriate? It might be the best thing you do for that patient, for that person.
Yes. So we'll do a framework, you know, and it's called an R2C2, and we'll talk about that, the how part. But I will say that attitudes, and you're absolutely right, Ravi. It's, my goodness, one of my studies themselves, basically our residents said, there is a culture of niceness, and I never get any meaningful feedback. This is in the US. Constructive feedback is rarely given. So my residents, when I did a focus group with this, and that launched my PhD, because it was fascinating to me talking about this culture of niceness and self-awareness. I went deep into psychology and the concepts from the business world, but it's fascinating. So how can we do that? I'll talk about the framework, but I will say, going back to basics, which is the faculty development, learner development, about this whole feedback literacy. I think the faculty need training on feedback literacy as well, and get the idea that feedback is not a recipe, okay? Put 2 spoons of salt and 2 spoons of chili powder, and then, you know, then feedback comes out the other end. But it is more an individualized and dynamic conversation. So training is very important. And because you're in the business world right now, you know very well the business world expects frequent appraisals, right? But feedback is given up, down, sideways, as my own residents said. Some of them are doing an MBA, and they said up, down, sideways. And then they come back to the medical setting and they say, well, I don't want to take constructive feedback. So it's so much is dependent on the environment, isn't it?
And just to add to Ravi's concern, I think the intent really matters. Like
Correct.
if you're very authentic, and if at all points of time the learner looks at us as someone who really is trying hard to or genuinely trying to get across the right things and to help them grow better, then I think even if the feedback is going to be slightly, the feedback needn't be harsh, but harshly given. But if the content is going to be a little difficult for the learners to take, even then, because of the authenticity of intents that we have created over a period of time, the feedback might be taken well,
Yes.
and that wouldn't create so much of a commotion amidst the learners, and it wouldn't create a doubt in the learner's mind.
You know, that
I
is
think
a
what
very fair point. This idea of beneficence. So, you know, we listen to our grandparents who scold us, but all the way we know that they are doing it for our benefit. So if a teacher-learner relationship is that much, there's a trusting relationship, and they know that we are coming from a good place, good heart, and I think the acceptance is much more. And yeah, yeah, the feedback is really a mixture of 2 spoons of salt, 2 spoons of chili powder, and 2 spoons of sugar. And I think that, I used to think that, and I think it's wrong for myself anyway. And talking about failure, I just want to make a point before moving on, which is failure. And this is where Carol Dweck, a psychology professor at Stanford University, has, you know, if you want to look her up, DWECK, fascinating work on mindset. And she talks about children who are given difficult mathematical problems and they cannot solve it, and they get very angry, very upset, and stop trying. And there are other children who don't get the answer and they keep on trying. So it's a growth mindset. Failure is an opportunity to improve. And in terms of Indians taking failure badly, I will say there have been a spate of suicides, even in the US universities, young students finding it hard to cope, the whole imposter phenomenon. And but I grant you, in India it's particularly nasty, the competition and that mindset. So so I wanted to talk about mindset before moving on to the last bit, which is the how. Besides training our faculty, besides training our students, here is a potential framework that might actually be useful. And this is coaching. And anyone who is engaged in sports knows this concept of coaching very well. And there is this model called R2C2 model, which you don't have to use, but then you can use any of the principles you feel like. So what is first R? R1 is relationship and rapport. Even in a short time, we can establish learning goals and then ask the learner to reflect on their strengths. What do they feel confident about? What do they find challenging? Where do they think the gaps in the performance are? So that is establishing goals as well. The second R is after the experience, after the patient encounter, just asking them a little debriefing questions. What are your overall reactions? Let them say anything they want, non-specific, but then dive into the specifics. What do you think you did well? Did anything challenge you? What do you think you could change? This is the plus and delta. What did you do well? Plus, what do you think you should have changed or done differently? See, again, it's the judgment is not a negative one. Then you move on to the actual content of the conversation, which is, I observed you did this. Do you agree? And then here are some suggestions. Let's think about one or two areas that you think you should improve on. Finally, the actual coaching bit comes in, which is develop action plans to work on those areas that were decided on in phase 3, but also create a timeline for the action plans in the next 6 months, in the next 6 weeks, but give some suggestions also. So this is R2C2. And we won't do this. And what I'm going to say is ultimately, coaching is telling us that feedback, I oversimplified it to 3 steps. So let the learner reflect on, where am I in this particular area of performance, clinical performance? Where do I need to be? Which means they need to be aware of the target. And then how can I get there? And every step, each of these 3 phases is facilitated and encouraged by us, the clinical teachers. So I'll stop here and we come to the end of the didactics, and I'll leave it to you, Tilaka, for any comments, questions.
Thank you so much, Dr. Subha. That was one of the most succinct talks that we've heard about giving a feedback, because we've covered so much about feedback, that too in a very interactive way that everybody could share their opinion. Because like you rightly pointed out, feedback is not only for teachers, because every practicing doctor, every practicing healthcare provider is going to work with a team, is going to work with the students, is going to work with somebody to whom they have to constantly give feedback. So I think the art of giving feedback that will be taken well, and the art of receiving feedback, I think both has to be taught explicitly. It just has to be part of our learning, so that we will know how to give as well as receive feedback. So there were a lot of things which were absolutely amazingly told, but I'd just like to ask your opinion on what you feel about giving feedback for different age groups, because most of the reflective feedback that we are talking about would work very well for people who are at probably the postgraduate level, who really have seen something, been there, and they know how to reflect and what to do. What would be the approach that you would suggest for undergraduate students who are not too much into the subject already, and plus the combined challenge of having a large number of undergraduates versus a relatively smaller group of postgraduates? What would your opinion be for dealing with the undergraduate feedback?
So undergraduates, especially in India, they are really, really young and less mature. And I think they need a lot more hand holding. And they need a lot more guidance. And so I say one thing, like the training. One, what is feedback? Why are people giving feedback? What is the purpose? And then the next bit of training is you need to start developing some specific learning goals, not just I want to be a great surgeon or a great anesthesiologist, but actually, how to formulate specific learning goals. So if they can bring those goals and then we can share them. And that's part of it. The other thing is in the action plan, they need more guidance, whereas we can probably sit back with the postgraduates and that they can make their own, and we can add a couple of points here and there. So they need a lot more guidance. So one of the, recently I started saying this, which is when they are young, you walk in front of them and show them. When they're a little more mature, you walk by the side. And then when they are really mature, you walk behind them and keep quiet. So I think that probably applies.
I think that's really beautiful. Before I'm going to request opinion from others, I strongly also feel that there is no system where we could, where if somebody is not really performing well and we find that out in the later stages, it's really very difficult. So I think identifying how people perform in a very early stage and for doing formative assessment as well as giving feedbacks right from the beginning of medical career and the postgraduate career would probably give us less heartache when they come to their final year and they're going to sit for exams and then we figure out that they're not performing so well. And in the same context, when you mentioned that because we are a team sport, we are going to play together and the strength of one person will kind of help to not make it very difficult for the weakness of another person to come while we do the patient care. Their peer-to-peer feedback becomes slightly relevant because if somebody in the team feels that, no, I think I am a better person to do this, or maybe you should kind of, think and do something more about this particular skill. How do you think that would be taken among the peers? And is there anything specific that peers need to know when they're giving feedback in clinical areas?
Yes. So there is very much when the students are trained, as an example, they're also trained on how to give peers feedback. And let's say in their tutorials or problem-based learning sessions, they do peer-to-peer feedback, but training is important because if we instill a sense of competition amongst peers, so one peer will be pretty harsh on the other. So training is very, very important, but peer feedback is very good. And in fact, it's this, I think in the business world, you probably, and in education world now, talk about multi-source feedback. So our nurses can give us feedback on different dimensions of our performance. Our supervisors can give us feedback on different dimensions. The peers can give different dimensions. And altogether, that is a recipe for our improvement because each one, we add things to the puzzle. So it is called multi-source feedback.
Thank you, Dr. Subha. So I'm going to request. I did. We did see Puneet sir who wanted to comment something in between. Puneet sir, is there something that you would like to share?
No, I've forgotten what I wanted to say at that moment. I forgot what that issue was. But I mean, it's a lovely one. I think we should have more of this because I think not just I don't think we are well trained to give feedback. But I love the paper which was just shared. The title itself tells us what we really need to do is the relationship. I think if the learner or the other person understands it's a relationship rather than something which is finger wagging kind of a thing, it's most effective, it's most listened, and possibly even implemented on. So I think that relationship part is like we have interns for a very short time. So what I realize is the one thing they listen very well is if they identify with you. So if you know a bit of their language, like we get foreign medical graduates, so I learned a few Russian phrases so that I can talk to them. And so I think getting that relationship right is the crucial thing, because if they know you're on their side rather than adversarial, I think it really, really helps. I'm looking forward to reading that paper in full.
Now, I did want to make a brief response. Thank you, Puneet. Som's comment as well. And I know Jenny Rudolph and debriefing with good judgment. So essentially, I think the simulation world has really taken feedback to a higher level, and debriefing and feedback, because you're in the moment, you're giving feedback, you're debriefing the situation, you're talking about what went wrong and how can we improve it with good judgment, without criticism of the person. So I'm glad you raised this. In fact, I think I just was a co-author in one of her papers. We share a PhD student at Mass General. So small world. So I do know Jenny Rudolph and her work.
Som, would you like to unmute and speak? Because you posted long stuff. It will probably be more interactive if you could just speak it out rather than type it. So feel free to unmute and speak whenever you're free. Ilango, you had your camera on. Did you want to say something?
Yes, you see, how I see this is our profession has to deliver performance. So when we want to have high performance teams like in transplantation, the post procedure or the post event debrief is very, very important to prevent small events from turning into catastrophes. So I have worked on both the sides with a team which takes feedback immediately. So this is what went wrong, and this is what we are going to change. And I have again worked with a team which never takes feedback. So I have found that progress happens when you debrief immediately, because corrective steps can be taken immediately, and that makes a lot of difference for pretty much every member of the team. I'm not talking about the surgeons or it makes work easier for the anesthesia assistants, the nurses, the junior doctors who are going to help. So that kind of debrief is very, very vital. And teams which fail to do this consistently are the ones which actually fail to progress. So having seen both the sides of the world, I value this very much. I learned this by reading from military commanders and talking to them, and they find that mission debriefing is very, very important for them. So I think that's where we have to learn if we have to build high performance teams. And and that's my take on it. Thank you.
No, I agree very, very much with what you just said. Debriefing and this R2C2 model, they actually built it initially for longer relationships, but they say this is for feedback in the moment. Okay, what did you do? What did you do well? What might you have done differently? Let's talk about it. Let's make a plan. So you're absolutely right. And I think again, not to flatter Tilaka too much, but she is in the simulation world, she could probably tell all of us, they really have taken debriefing and feedback to a high level. And it came from other industries, didn't really come from the education world.
Yeah, certainly. So there's a lot of emphasis given on reflective practice, like Dr. Subha just said. It's like keeping a mirror, and I completely agree with Dr. Ilango, because after every critical event that has happened, or even without any event, debriefing for marginal gains, 1% gain. So there's no 100% efficiency at all that we are looking at. How are we going to improve my performance individually and the team's performance by another 1% the next time? So that's growth mindset. That's quality. So every single team should have a debrief clinically when they have performed something that is challenging, at least, because for every case, it's going to be a little bit difficult and time consuming. But at least if something has come up challenging, some acute event has happened or something, every time if they sit back and do debriefing for marginal gains, then they kind of get points on which some action steps and timelines will be taken. And that team kind of consistently keeps growing. Can't agree more on that, Dr. Ilango.
No, completely understand. And one thing I just want to add, which might be interesting to all the simulation and debriefing people, which is they're also, in the paramedic world, in the emergency services, they have found there are young trainees, and they're seeing such disasters and serious events. And the one thing that's been lacking, they debrief the event from a process standpoint, but they found a lot of young people are leaving the profession and, even going into deep depression. So they're saying the incident debriefing should be also combined with some emotional debriefing. Like imagine young people seeing death for the first time, death and dying and suffering and other complications. So that is another aspect of debriefing that people are talking about these days.
So there are some comments where JK has written constructive feedback helps and 360 feedback is also helpful. But for adults, how long a feedback is good enough? And at some point, we have to responsibly divide the wheat from the chaff.
I don't know if there can be a formula for how long, but you need a system for sure. I think comments were made. You need a system where the trainees and even practitioners, all of us, are expected to deliver on certain expectations. There are milestones that we need to cover, the yardsticks for competence. And so, even all of us, think about back to the business world, some of you who are studying in the business world, there's appraisal happening all the time, employee appraisal. We have to some extent, as consultants, we have appraisal as well. But yes, that's the only way. Constant appraisal, feedback in the moment, and 360 or multi-source feedback. We need it from everyone. So if you were an anesthetist, an anesthesia consultant, you need from your team, you need some sort of feedback, not just little bits. Like, what is it that you need to change? What is it that you're doing well? How can we come together as a high-functioning team? So it's not a matter for everyone, the duration is going to be different. However, I'll give you as an example for our residency programs, our residents are supposed to meet with their advisor every few months, every 4 months or so. And they meet more often if a flaw is identified or a performance issue is identified, because then remediation plans go into play. So if they're doing well, twice a year, fair enough. But if not, remediation needs to happen earlier.
Yeah, Soma, you have your camera on. We'd like to hear. I know it's, rather than read your comments, just unmute yourself, please.
Oh, thank you, Vijay. Yeah, I think it was a wonderful talk and feedback. I think I personally, whenever with postgraduate students, I'm a postgraduate facilitator. Nowadays, I think I agree with Dr. Subha. It's difficult to handle them, but then when we sit with them one-on-one, having a one-on-one conversation, it becomes very easy to understand them, understand their perspectives. It's all about what I felt was it's all about giving a safe environment for them to open up, speak, and then reflect upon, giving them an opportunity to reflect upon what they have said just now, and then take it from there to guide them. So this was a wonderful talk. So I can relate to so many things that have happened with me. Like before my fellowship and before my introduction with Jenny, my perspectives were different. And then I didn't, thanks to COVID, I did a wonderful course called the Feedback Course led by Jenny Rodolph. And she introduced me to two books by Sheila Heen and Douglas Stone. One on how to discuss what matters most. That's a difficult conversations. So that's one thing. The other one is thanks for the feedback. how to give feedback as well as how to receive feedback. I guess I wanted to share this because these two books are wonderful books that we can uh, read to how to give and receive feedback. It just changed my perspective a lot. So after every time I used to take postgraduate classes, and whenever I give class, I have a feeling that I'm in top of Mount Everest, that I have given justice to the topic and everything. And whenever I ask for feedback from these students, they all will say it's wonderful, wonderful. But then the words, they don't match the face. And then so I asked them to send it in a WhatsApp message or something. And in that, so what I did was to send out Google Forms anonymously so that they can fill and send me. And then I heard then your classes are good, but then you take lots of time. So I have to start data at 9 o'clock. You relieve us at 8:55. It takes time for us to go and prepare. So I'm really scared to tell that to you. It's such a simple thing that didn't strike my mind, but then that feedback was an important thing from their perspective. So Jenny always used to say, put the learner's perspective first, so that you will have if you understand the learner, it becomes easy for you to drive the point that you want to drive. So that was one of the important feedbacks that I learned from doing that. And nowadays, all the learners are all very techno savvy. And when we introduce technology to them, they will be more than happy to utilize it. And then we need to find a middle path, how to utilize that technology to receive and give feedback. So I have a collection of my Google Forms. After every classes, I used to send it out. And then looking back at the past 1 year or so, I had I think a couple of days ago, I was looking at all the feedback, collating it, and thought of writing something. And it was very interesting to see how over a period of 1 year, the feedback has changed about me. And rather, in fact, it has helped me to grow a lot. I think that was one of the important things that I have learned from Jenny a lot. Thank you very much.
Thank you for the comments. Yeah.
Thank you so much. So that also brings us to another very important question of how do teachers receive feedback? Of course, Google Forms is one of the methods, but I would like to hear from Dr. Subha as well as others as to how they receive feedback from their learners and how to encourage them to give feedback to us, because I think we should know how we are performing as well.
You can turn around the feedback literacy to the teacher's side. So showing our learners that we are appreciative of their feedback, that we will receive and use our good judgment, and then actually, make an actionable plan. So turn back and said, you said, my learners, the last rotation, gave me this suggestion. So I have turned this around. And here is what I'd like you to observe and give me feedback on this month. So I think seeking feedback. In fact, there's one research study which basically said the learner said, I will not initiate feedback, but if you seek feedback and tell me what you're seeking feedback on, then I will consider giving it to you. All right, so that's one. And the environment is very important, that it's a non-threatening environment. So keeping that respectful, non-threatening, non-judgmental environment where their comments are welcomed, that is quite important. But the person on the higher on the power chain needs to be the one initiating the conversation. Cannot expect our learners to initiate the conversation.
Thank you, Dr. Subha. Anybody else would like to share their opinion on how they receive feedback from their students?
So I think the most honest we had, so it might appear to be on the lighter side because they're all at their lighter moment at that time, is when we give farewells to our MCH students. So, at that moment, they are not worried about, and they're going to leave the hospital, they leave the department. So there's a bit of alcohol in their systems at that time. So they usually give what all they felt was, it does lead to a bit of heartburn amongst us, and it's usually a communal affair. So I'm not sure that's the kind of formal feedback Shiva was referring to, but sometimes it's been the most honest, and we have acted upon those, at times. So sometimes a combination of formal and informal might actually be the best.
Agreed. And we can use R2C2 to turn things around. Create that rapport with the student, tell them what our learning goal is, tell them what we find challenging, and then after the experience, debrief instead of we can self-reflect. That went well, but I don't think that I couldn't manage this challenging patient and I had trouble. Just a little acknowledgement of what our challenges were. And then tell me, can you give me a couple of pointers and how I can get better at this? So the seeking has to come. We can turn around the R2C2 and use it with our learners.
And another very curious question for me is, how do we know our feedback is working? Because we end up giving them feedback. How do we assess if what we have given is actually taken by them and it has made a difference to their practice?
So if you have a longer, say a rotation is long, and you have the opportunity to observe this postgraduate trainee or student for even about 2 weeks, 3 weeks, you can have multiple points of feedback and say, okay, today, what's your actionable item? And then the next time say, last time we discussed this. So what happened? Were you able to implement your plan? So if it's a longer relationship, it's easier. If it's a short relationship, you probably have to encourage the learner to go to the next supervisor and enact that plan. So it has to be multiple people. So a longer relationship, longitudinal relationship is much easier. Yeah, there are two hands before. Yeah.
Ajay?
Dr. Ajay?
Thanks very much. I really enjoyed listening to. Can you see me there? Yeah. Ajay Sharma here. I'm really going to really share my experience with developing instructors for ATLS and few other critical care courses. So it is a very essential component of any instructor development program, as in ATLS, which is really very well thought about. And like in India, there are about 35 centers which ATLS India has really developed. So the question which has been really posed as by Dr. Muthaiya a moment ago was, how do you know that there is the learner is going to effect a change in his or her behavior, learning process? The purpose of learning is like, who is most interested in changing, improving is myself, if I'm the learner. That if it gets reflected in my change behavior, then that is actually that's what I'm really trying to achieve. So who would tell the learner? So you can give 10, 20 points of feedback. It won't work. So ideally it should be coming from within. So we help the learner to develop that reflective exercise he or she learns and comes up with the points, 2 or 3 learning points after every event. Anything more than 2 or 3 learning points, it would just not really be going to the head of the learner. So we use the technique called Pendleton's technique, modified Pendleton technique, whereby you sandwich. Okay, so ask the immediately after the event, simulated or real life, ask the learner, oh, how did it go? So I can tell, oh, it was so good or not so good, or you could do better. Ideally, should be coming from the learner himself or herself. And we fine tune it. And then what is the next step? Ask the learner, oh, how could you have done it better? Because if I really decimate the learner, it won't really work. So there would be a big wall there. So let the learner say, oh, I could have done it better than this. Oh, no, you are being too harsh on yourself. At times they are too harsh. So you fine tune their how they could do better. And then third one is take home messages, which should not be more than 2 or 3. Anything more than 2 or 3 means feedback process is not really going to be effective. So just to point out the modified Pendleton technique, which we use in developing instructors for future, we use it very, all the time in all the ATLS instructor courses. Thank you.
Thank you.
So much, sir. Thank you, sir. Dr. Ravi?
Sorry, I'm struggling to unmute myself. Thanks. This is just an extension of what Puneet had said and what you had asked about feedback for the teacher. So flipping it over, in industry, we are required to have regular required to seek regular stakeholder feedback, and that is done on a it's an official way of doing it. You need to have 2 people who are above you in the matrix organization, 2 peers, and 4 people who are below you in the matrix organization give you feedback. And then you have to sort of work with your manager to see how you can address those issues, if any have come up. The person giving the feedback is asked to provide things they did well, things they didn't do well, and areas of improvement. And so this is a very formal sort of feedback form as well. So I do it for my peers and others as well. And I get it every year. So I don't know if this is formalized for, in an academic center or setting, but I think it would be very useful to do something like that.
I agree completely. And that's, you basically proved the point I was making, that the best feedback recommendations comes from industry.
Totally. So we do have a few comments. Thank you, Joy, for that. JK is Joy Kezia, who is the CNO of Apollo Vanagram. And she mentions that, yes, timelines and periodical feedback is essential. Feedbacks that's documented for each other's safety. And emotional support for the second victim soon after an incident helps the new learner.
Mm-hmm.
And also another person has commented on, every system works on hierarchy. Feedback can take a backstand. I feel hierarchy goes from top to bottom. Feedback should go from bottom to top, which is difficult but can be truthful, and it's an excellent lecture.
Yeah.
And Dr. Yogesh has commented that initially it feels bad that you are called fast, but then you asked for your mistake. Now correct the mistake as pointed out by students. Okay. So is there anything else that anybody would want to share, comment, or question?
I just wanted to add, when we were talking about eliciting feedback or sort of demonstrating feedback literacy, if you want to put it that way, is if some feedback was given and you make a specific reference to that in the next talk, like say if I was speaking too fast, and then the next time I make a conscious effort to speak slower, and also mention that, I received this feedback that I was speaking very fast. Am I doing better this time, or something like that?
Yeah.
If we overshot time, that was one of the comments. The next time, try and finish 5 minutes before, and so then they'll feel that, okay, this person listens, and it's worth my time and effort to actually give feedback to this person. It was just a random thought that entered my mind. Yeah.
No, it's basically being a role model. That's it. So we role model this feedback literacy and feedback seeking, and showing that we've changed from seeking feedback, then, we are serving as an example to our learners.
So, Radhakrishna, we're almost reaching the end of time. Do you want to say something?
Yeah, it's a wonderful and refreshing talk, and in the comments that followed also very good. But in my opinion, I think the feedback is an alien term in Indian medical education. It doesn't fit in. See, I can't say much about my undergraduation, but my post graduation and super specialty surgical training, nothing like feedback ever existed. Neither my teachers told whether I'm doing right or wrong, nor we had dared to say anything in the reverse. Now, after I joined All India Institute, Dr. Nandi's unit, things were different. As Ravi Shankar was rightly mentioning, we have there a session once every 6 months called Meet the Professor. The professor meets everybody from number 2 till the last one, takes 10 minutes. He's got a record, he's got a lovely notebook in which he picks up page by page and says, what is your aim in joining this unit? What is that you wanted to learn? How much have you learned, and where all you are lacking? Then I have to reply whichever way. He'll make notes. Then he will also take up my operation schedule and says, this is the area where you are less than the others. So then he'll put it to number 2, saying that these are areas he has to focus on, and he'll give more chances. So everybody gets same chances. But then the painful thing comes next. Radhakrishna, you're not focused. You're very fickle-minded. This part you have to improve. I mean, he's very, very forthright in saying that, and he doesn't mince words. Now, the other thing is, he always believed that Chennai fellows very casually tell lies. In other words, they don't. Like, for example, if I was working in Chennai and my boss, a big man in Madras Medical College, he calls and says, see, in the phone, he says, how was that girl? Or what is the rail tube output of that girl? I can't dare ask him which girl. I'll say 160 cc's. That's a lie. Because I'd say something. Dr. Nandi noticed that, and once he asked me, what is that girl's blood sugar? I said 94. He said, come, we'll go and see. And then you know what it followed. He has a subtle way of telling that, see, first thing you should learn in life is if you don't know, you say, I don't know.
Right.
And
Exactly.
as you're talking about how learners change, I changed from then on.
Yeah.
The first thing I say, I don't know. And I keep telling all my assistants that if you're not seen, not done, say, I don't know. Don't try to make up something. I mean, that's a wonderful thing. Now, I think the one group of doctors who can give the best feedback are the doctors at the head end. Vidya sees every positive and negative thing in every surgeon, but he never tells anybody anything. Not even once. Okay, she may discuss in private with the people from her own tribe or whatever, and there's absolutely no feedback. Whether I'm doing right or wrong, she knows, but she doesn't tell me. But I think that is a major, major flaw, and I think she has to buckle up and do something about it. I think that's where it starts when it comes to surgery. See, India is a country. If my patient comes and asks me, what is your success in Whipple's procedure? What percentage success? I don't tell anything. No hospital like in the US says it's 99% success for CABG, 94%. I think these things are not looked at. And finally, as far as mortality, morbidity meetings are concerned, majority of them are sham.
Yeah.
A lot of time, the actual people involved are not there. Others discuss, and it's very nothing is actually, everything's swept under the carpet. And if at all in academic institutions, I found people fighting with each other, and it leaves in a very bitter taste. I think feedback has a lot of meaning in the present circumstance, and I think Vidya should start doing it from now on, and she should call each group of surgeons and give her feedback. Let's see what happens. Wonderful topic and very well discussed, Shubha.
Thank you. But you can't ask Vidya to do it all of a sudden. You need to set a system where Vidya is empowered to do it.
How is it done? Please tell me.
No, we have a lot of people here from who are in management and business and industry, and they can tell us all about. No, it basically comes from chief medical officer, medical directors. You set up a system in which this is an expectation. So we want the anesthesia consultant to provide feedback to the surgical team. We want the chief nursing person, OR nurse, to give feedback. So you set a system, as they were talking about in industry, there is a system in place, which is you have to get the 4 up, 4 sideways, 4 down. So that is, I would say that is an excellent system.
Vidya, you can respond to that.
Yeah, no. So just to, I do give feedback, but the point which was made through all along is most people will not give feedback unless you get a inkling that the other person is wants it or willing to receive it. So that part. So I definitely give feedback to those I know will take it. I mean, so yeah, it's not formal, obviously, but Tilaka knows I'm not a. Yeah, you haven't known me long enough, I guess. So as far as anesthesia is concerned, but yeah, I fully take your point. The reverse also is true. Like because we are all members of a team, if we make it formal just about the whole thing, like from the scrub nurse to the surgeon, the anesthesiologist, the technician, if we all have perhaps every 3 months, one group huddle or whatever, and then,
Yeah.
you know,
Mhm.
we just discuss, or like Tilaka said, if some particularly difficult case we did, or we had an adverse event or something, maybe if we do a group huddle, automatically, you know, people will feel open to come up with both plus and delta. Please note, I'm catching up on Tilaka's no semantics. So yeah. So we tried that even for Marvelous Medicine, actually. The first time, I think after 50 episodes or something, we tried to get everyone to critique and say what went right and what went wrong. So yeah, Shubha, we'll try and make a start for this. That at least
It's absolutely, absolutely. I agree with Pata sir that somebody who's really watching a lot of things will be in the best position to give feedback. But unless a culture is set,
Yeah.
where it's not just with you, because she knows you well, but if it's not going to be with every single team, it doesn't work that way. It is a culture which is a very inclusive culture, and I'm so glad that we are repetitively bringing nurses to be a part of the team, technicians to be a part of the team. So it's about what anybody is doing to a patient. Anybody who's in the team has to be a part of the huddle. So that culture is still not very rampant in our practice. It's certainly not going to be very easy, but it's definitely not impossible, because somewhere we need to start. And I think it's a good start for each of us present here to just start doing it at a very small level. And once we start seeing the kind of a positive, it's a ripple effect, the kind of positive effect it starts bringing into the culture, and how safe people start feeling dealing with us, and how many near misses will be brought out just because we've given them space to speak up. So I think it's a good start for all of us to just do it in a small way, and to kind of scale it up as and when we become comfortable and the teams become comfortable.
Yeah, it's as we come to the end of our session, I think great points have been made. We've actually talked about hierarchy, we've talked about culture, we've brought in concepts from education, we've brought in concepts from industry, and we all, I think, will go out learning something new about how we can engage our learners in feedback conversations, and how we can be role models in seeking feedback.
Yeah, I was just about to ask you to sum up, and you did it without your closing comments were just there. So thank you everybody for logging in.
Puneet wants a part 2. You need to fix a date for it, then close.
We will. Both of us will look into our calendars and get back to you very soon. So I just wanted to make a quick announcement that next Thursday we will be taking a break because it's Independence Day, and so we'll meet 2 weeks from now with yet another episode of Marvelous Medicine. Till then, take care and stay safe. Good night.